Imagine this. You're in your 60s feeling those occasional aches and pains, a bit more tired than usual, but you brush it off thinking, that's just what happens when you get older, right? But what if I told you that what you're dismissing as normal aging could actually be something far more serious? Pancreatic cancer silently claims over 65,000 American lives every single year. Let that sink in for a moment. That's enough people to fill a major sports stadium. Gone? Because this deadly disease often hides behind symptoms we mistake for everyday discomforts. Here's what's truly frightening. Pancreatic cancer has just a 12% 5-year survival rate, one of the lowest of any cancer type. Why? Because by the time most people realize something is seriously wrong, the cancer has already spread. But here's what your doctor isn't telling you. There's actually a critical 3 to 6 month window where subtle signs begin appearing, signs that could save your life if you know exactly what to look for. In the next few minutes, I'm going to reveal 8 specific warning signals that pancreatic cancer sends out before it becomes deadly. These aren't obvious symptoms. They're subtle changes that most people, and even some doctors, completely overlook. One viewer who watched this video last year recognized one of these signs in her husband, and her quick action led to early detection that literally saved his life. I've spent years researching these early indicators, consulting with top oncologists and gathering stories from survivors. What I've discovered will change how you think about your body's signals forever. If you or someone you love is over 60, the information in this video could be the difference between catching this disease when it's still treatable or facing a devastating late-stage diagnosis. And make no mistake, knowing just one of these warning signs could add years to your life or save someone you care about. So before you dismiss that persistent discomfort or unexplained change in your body as just getting older, stay with me. What you learn in the next few minutes might be the most important health information you ever receive. Your future self might thank you for not clicking away right now, because knowledge truly is power, especially when every day of early detection matters. Let's start with something many of us experience as we age: changes in digestion. You might think that occasional bloating or nausea is just part of getting older, but here's the critical information you need to know. These subtle digestive shifts could be the first alarm bells your body is ringing. Pancreatic cancer is often called a silent killer for good reason. Its initial symptoms blend in so easily with everyday discomforts that nearly 80% of patients overlook these early warning signs. What's especially important to understand is that these symptoms often appear 3 to 6 months before diagnosis, giving you a crucial window for early intervention if you know what to watch for. Why does this happen? Your pancreas plays a vital but often unappreciated role in your digestive system. Think of it as the body's personal chemist, producing enzymes that break down the foods you eat, transforming fats, proteins, and carbohydrates into nutrients your body can actually use. When a tumor begins to form in or around this critical organ, it disrupts this delicate chemical balance. The result? Food isn't properly processed, and your body starts sending distress signals. You might notice persistent nausea that doesn't seem tied to what you've eaten. Maybe you're experiencing unusual bloating after meals that used to cause no issues. In some cases, vomiting occurs without an obvious trigger. While occasional indigestion is normal, these symptoms tend to linger much longer when they're connected to pancreatic issues. They don't simply resolve with antacids or dietary changes. One particularly telling sign that's often missed is a change in your stool. If you begin noticing pale, oily, or greasy stool, pay close attention. This happens because your pancreas isn't releasing enough enzymes to properly break down fats. Instead of being absorbed by your body, these undigested fats pass through your system, creating that distinctive sheen or lingering odor. This isn't just an embarrassing bathroom issue. It's a valuable clue that something deeper might be happening with your pancreas. The key takeaway here? If digestive changes persist for more than 2 weeks without improvement, don't wait to bring them up with your doctor. By recognizing these patterns early, before they escalate into more obvious symptoms, you could gain precious time for intervention. Not every stomach issue signals cancer, of course, but knowing when digestive problems deserve medical attention could literally save your life. Now, let's connect these digestive issues to another critical warning sign you need to be aware of, one that's often mistaken for something positive. You're looking great. Have you lost weight? It's a compliment many of us would welcome, but when weight drops off without effort, it could actually be cause for concern, especially after 60. This unexplained weight loss is directly connected to those digestive changes we just discussed, and understanding this connection could be life-saving. When pancreatic cancer develops, it doesn't just affect how you feel after meals, it fundamentally disrupts your body's entire nutritional system. Remember those digestive enzymes we talked about? When cancer interferes with their production, your body can't extract nutrients efficiently from food. The result is unintentional weight loss. Not because you're eating less or exercising more, but because your body literally can't access the calories you're consuming. For older adults, this creates a particularly dangerous situation. Seniors are already vulnerable to a condition called sarcopenia, age-related muscle loss, and often face nutritional challenges even without underlying illness. Pancreatic cancer accelerates these issues, rapidly depleting both muscle and fat reserves. Unlike the gradual changes that come with healthy aging, this weight drop is swift and unexpected, often occurring within that crucial 3 to 6 month window before diagnosis that I mentioned earlier. Medical professionals have a specific term for this type of weight loss: cachexia. This condition affects up to 80% of pancreatic cancer patients and is characterized by rapid muscle wasting and fat loss that continues even if you maintain your normal eating habits. Your body's metabolism becomes severely disrupted, breaking down tissues at an alarming rate. You might notice clothes hanging loosely within weeks, increasing weakness, and a significant drop in energy, all while eating normally. Picture this scenario. A previously active 67-year-old notices their clothes fitting looser over just a few weeks. They might brush it off, thinking it's due to stress or smaller meals. But as weeks turn into months and the pounds continue to disappear without explanation, what seemed like a minor change could actually be pointing to pancreatic cancer, a disease that's often overlooked until it's advanced. The good news is that recognizing this pattern early can make a tremendous difference in outcomes. If you've lost more than 5% of your body weight over a few months without trying, that's about 7 to 8 pounds for someone who weighs 150 pounds, it's crucial to consult your doctor. While weight loss doesn't always signal cancer, sudden, rapid changes without explanation should never be ignored or celebrated without understanding their cause. This unexplained weight loss often coincides with another symptom that's frequently misinterpreted, especially as we age, a specific type of pain that deserves your immediate attention. We all experience back pain as we age, it's practically expected. But there's a specific type of back discomfort that might be signaling something far more serious than routine aches and pains. The challenge is knowing the difference between common back issues and the distinct pain pattern connected to pancreatic cancer. For many seniors, persistent back pain gets written off as arthritis, poor posture, or everyday muscle strain. It's easy to reach for a heating pad or over-the-counter pain reliever without giving it a second thought. However, back pain associated with pancreatic cancer has unique characteristics that set it apart, characteristics that, once you know them, could alert you to a problem requiring immediate medical attention. The location and quality of this pain provide important clues. Unlike the localized discomfort of arthritis or muscle strain, pancreatic cancer pain often begins in the upper abdomen and radiates outward into the lower back. Many patients describe it as a band-like sensation, a persistent pressure that wraps around the torso. Rather than the sharp twinges or morning stiffness typical of joint issues, this pain presents as a deep, constant ache that simply doesn't go away, regardless of position changes, rest, or even pain medication. Why does this happen? The answer lies in the pancreas's location deep within your abdomen. Situated near critical nerves and organs, when a tumor grows in this area, it can press against these surrounding structures, creating pain that radiates outward. This internal pressure produces discomfort that behaves differently from typical back pain in key ways that you need to be aware of. Pay attention to when the pain intensifies. This can provide crucial information. Pancreatic cancer pain often worsens in specific situations. Lying flat on your back might suddenly become uncomfortable, making sleep difficult. Even more telling is pain that intensifies shortly after eating, when your pancreas activates to aid digestion. These patterns, discomfort while lying down or after meals, are red flags that distinguish this pain from routine back problems. The contrast is clear when you consider how arthritis or muscle pain typically responds to rest or position changes. Those conditions often improve with specific adjustments or treatments. Cancer-related back pain, however, maintains its steady, unrelenting presence regardless of what you do. It feels like a constant weight that never lifts, a nagging discomfort that becomes your unwelcome companion day and night. If you're experiencing back pain that persists for weeks without improvement, doesn't respond to typical remedies, and especially if it worsens after eating or while lying down, don't wait to discuss it with your healthcare provider. This particular kind of persistent discomfort might be your body's way of alerting you to an internal issue that needs immediate attention. Now, let's explore another surprising warning sign that's often overlooked. One that affects millions of seniors but could sometimes indicate something more serious than just age-related changes to your metabolism. Being diagnosed with diabetes after age 60 might seem like a common health challenge. After all, our bodies naturally change as we age. But there's something crucial you need to know. Sometimes new-onset diabetes isn't just about lifestyle or genetics. It could be connected to pancreatic cancer. This vital connection is frequently missed, even by healthcare professionals. Here's what happens. Your pancreas has two essential jobs: producing digestive enzymes, which we've already discussed, and creating insulin to regulate your blood sugar. When a tumor develops in the pancreas, it can interfere with both functions simultaneously. The cancer can disrupt insulin production or block its proper release, causing sudden blood sugar regulation problems. What makes this particularly important is that these diabetes symptoms can appear differently than typical age-related type 2 diabetes. The key differences to watch for are the timing and severity. Diabetes linked to pancreatic cancer often develops rapidly and proves unusually difficult to control, even with medication. Your blood sugar readings might swing dramatically despite following doctor's orders, or you might require escalating medication doses in a short time frame. These patterns differ significantly from the gradual onset and relatively stable progression of typical type 2 diabetes. It's especially important to pay attention to diabetes that arrives alongside other symptoms we've discussed. If your new diabetes diagnosis comes with unexplained weight loss, rather than the weight gain often associated with type 2 diabetes, persistent abdominal discomfort, or decreasing appetite, these combined signs suggest your pancreas might be affected by something more serious than routine metabolic changes. Consider this scenario. A 65-year-old with no family history of diabetes and no weight issues suddenly develops high blood sugar. Their doctor diagnoses diabetes and prescribes medication, but simultaneously, they're experiencing unexplained weight loss and occasional upper abdominal pain. While their medical team focuses on controlling blood sugar, these additional symptoms could be pointing directly to a pancreatic problem that requires immediate investigation. Remember, most new diabetes cases in seniors are indeed just diabetes, but being aware of these potential connections could save your life. If you've been diagnosed with diabetes after 60, especially if it appeared suddenly or alongside other symptoms we've discussed, Ask your doctor about evaluating your pancreas. Early detection through simple screening could make all the difference in catching a potentially serious condition when treatment options are most effective. As we continue exploring these warning signs, let's turn to something visible that you might notice in the mirror. Changes in your skin that could be signaling an internal problem. Your skin tells a story about your health, and sometimes that story requires urgent attention, especially after age 60. While most of us expect some changes in our skin as we age, increased dryness, age spots, or wrinkles, certain shifts in skin appearance can signal something far more serious happening internally. Pancreatic cancer can sometimes cause a blockage in the bile duct, the channel that allows bile to flow from your liver to your intestines. When this happens, a substance called bilirubin, a yellowish compound produced during the normal breakdown of red blood cells, can't be properly eliminated from your body. Instead, it builds up in your bloodstream, eventually causing jaundice, a yellowing of the skin and the whites of the eyes. What makes this particularly challenging for older adults is how subtly it often begins. Rather than an obvious yellow tint, jaundice might first appear as a barely noticeable dullness to your skin tone, something easily dismissed as general aging, sun damage, or poor lighting. You might not even register the change until it progresses further, losing precious time for early intervention. Pay close attention to itching that doesn't have an obvious cause. As bilirubin accumulates in your skin, it can irritate nerve endings, creating a persistent, sometimes intense itchiness. This isn't the typical dry skin itch that many seniors experience. It's more pervasive and doesn't respond well to moisturizers or anti-itch creams. This unexplained itching, especially when accompanied by other subtle changes, could be an early warning sign of bile duct obstruction. Before you even notice skin yellowing, your urine and stool might provide important clues. Dark, tea-colored urine can appear as your kidneys work to filter out excess bilirubin, creating a concentrated discoloration that's noticeably different from your normal urine color. Simultaneously, your stools might become pale or clay-colored, almost whitish, because the bile pigments that normally give stool its characteristic brown color aren't reaching your digestive system. The pancreas's position near the bile duct explains this connection. When a tumor grows in the pancreas, it can press against or block this vital pathway, causing bile to back up into the liver and eventually leak into your bloodstream. This disruption creates the telltale triad of symptoms: itching, dark urine, and pale stools, that together signal a potential issue with bile flow. If you notice these changes persisting for more than a few days, especially if drinking more water doesn't resolve the dark urine, it's crucial to contact your doctor promptly. While not all skin changes indicate cancer, this particular cluster of symptoms warrants immediate medical attention. Your skin might be offering early warning signs that something isn't right internally, and recognizing these subtle shifts could lead to life-saving early detection. Now, let's discuss another symptom that's easily dismissed but could be critically important: a type of exhaustion that goes far beyond normal tiredness. We all feel tired sometimes, it's part of life. But there's a profound difference between normal fatigue and the bone-deep exhaustion that might signal something serious like pancreatic cancer. For seniors especially, it's easy to attribute increasing tiredness to just getting older, but understanding when fatigue crosses the line could literally save your life. The exhaustion associated with pancreatic cancer is distinctly different from everyday tiredness. This isn't about needing an extra cup of coffee or feeling sleepy after a busy day. This is a relentless, overwhelming drain that persists regardless of how much you rest. It's like your body's energy reserves have been fundamentally depleted, leaving you struggling to complete even basic daily tasks that were once effortless. Why does this happen? The connection lies in how pancreatic cancer affects your entire body. As we've discussed, tumors in the pancreas interfere with proper digestion and nutrient absorption. Your body essentially loses access to the fuel it needs, creating an energy crisis at the cellular level. Over time, this nutritional deficit manifests as profound fatigue that simply doesn't improve with rest or normal recovery methods. What makes this exhaustion particularly telling is its persistence and impact on daily life. Unlike normal tiredness that fluctuates with activity and rest, cancer-related fatigue maintains a constant presence. Tasks you once handled easily, preparing meals, walking to the mailbox, participating in social activities, suddenly require monumental effort. It's as though your energy has been turned down to the lowest setting and stays there, regardless of sleep or relaxation. This exhaustion affects you emotionally as well. Many experiencing cancer-related fatigue report feelings of sadness, anxiety, or irritability alongside their physical symptoms. Sleep patterns often become disrupted. You might feel constantly tired yet struggle to get restful sleep. This creates a vicious cycle where physical exhaustion and emotional strain reinforce each other, further diminishing your quality of life. Imagine waking up after a full night's rest and feeling as though you haven't slept at all. Throughout the day, each activity depletes your minimal energy reserves faster than normal, leaving you completely drained by early afternoon. Despite additional rest, your energy never fully recovers, and this pattern repeats day after day, week after week. This relentless cycle is what distinguishes concerning fatigue from normal aging. If you've experienced overwhelming tiredness that has persisted for more than a month, interferes with normal activities, and doesn't improve with adequate rest, it's essential to discuss this with your healthcare provider, especially if accompanied by other symptoms we've discussed like weight loss or digestive changes. While not all persistent fatigue indicates cancer, recognizing when exhaustion is abnormal ensures any underlying issues are addressed promptly. Now, let's examine one more critical warning sign: a specific type of abdominal discomfort that should never be ignored. We've all experienced stomach aches or abdominal discomfort at times. They're typically temporary and often linked to something we ate. But there's a specific pattern of abdominal pain that deserves your immediate attention, as it could be signaling pancreatic cancer in its earlier stages. This isn't your typical stomach upset or indigestion. The discomfort associated with pancreatic cancer has distinct characteristics that set it apart from routine digestive issues. It typically manifests as a dull, persistent ache or deep pressure sensation in the upper abdomen, the area directly below your ribs. Unlike the cramping pain of constipation or the burning sensation of acid reflux, this discomfort feels more like a constant, gnawing presence that doesn't fully resolve. What makes this pain particularly noteworthy is how it behaves. It often radiates from the abdomen to the middle of the back, creating what many patients describe as a band-like sensation encircling the torso. This pain typically remains steady rather than coming and going in waves. Most tellingly, it rarely responds to common remedies, antacids, over-the-counter pain relievers, or dietary changes typically provide little to no relief. Instead, the discomfort becomes a persistent companion that gradually intensifies over weeks or months. The explanation for this unique pain pattern lies in the pancreas's location deep within your abdomen. Nestled near critical nerves and surrounded by other vital organs, the pancreas affects nearby structures as a tumor grows. This creates pressure that translates into that characteristic deep, radiating discomfort. Unlike surface-level pain that might result from muscle strain or skin issues, this sensation originates from deep within your core, making it feel fundamentally different from more common abdominal problems. Pay particular attention to when this discomfort intensifies. Does it worsen after eating, especially fatty meals? This timing is significant because your pancreas increases enzyme production during digestion. If a tumor is obstructing normal function, this increased activity can amplify the pain. Similarly, does lying flat make the discomfort more noticeable? This position can shift internal pressures, often making pancreatic pain more pronounced when you're trying to rest or sleep. If you're experiencing abdominal discomfort that persists for more than 2 weeks, feels deep and steady rather than intermittent, radiates to your back, and worsens after eating or when lying down, don't wait to discuss it with your doctor. While not all persistent abdominal pain indicates cancer, These specific characteristics warrant prompt investigation. Requesting pancreatic imaging could lead to early detection when treatment options are most effective. This type of physical discomfort can take a significant emotional toll as well, which brings us to our final warning sign. One that's often overlooked but critically important. When we talk about cancer symptoms, we typically focus on physical changes. But what many people don't realize is that emotional shifts can sometimes be early warning signs as well, particularly with pancreatic cancer. These psychological changes aren't just reactions to feeling unwell. They can actually be directly connected to how the disease affects your body. Pancreatic cancer disrupts multiple systems simultaneously, not just digestion, but also energy production and hormone regulation. This widespread impact can trigger emotional changes that might seem unrelated to physical health. You might experience unexplained sadness, anxiety, irritability, or a general sense that something isn't right, even before more obvious physical symptoms become apparent. The connection between physical and emotional symptoms creates a complex interplay. The persistent fatigue we discussed earlier leaves you with little energy for activities you once enjoyed. Chronic pain or discomfort can disrupt sleep, further depleting your emotional reserves. Nutritional deficiencies from impaired digestion can affect brain chemistry, influencing mood in subtle but significant ways. Together, these factors can create emotional distress that seems to arise without obvious cause. What's particularly concerning is how easily these symptoms can be misinterpreted, especially in seniors. Emotional changes might be attributed to life circumstances, retirement adjustment, loss of friends, or other life transitions, rather than considered as potential health warnings. For example, someone might assume their withdrawal from social activities stems from normal aging rather than recognizing it as a response to physical changes occurring within their body. Consider this scenario. A typically engaged, active 72-year-old gradually becomes withdrawn, irritable, and uninterested in favored hobbies. Friends and family might suggest it's depression related to aging or retirement. However, if these mood shifts occur alongside subtle physical changes, perhaps mild fatigue, slight weight loss, or occasional digestive discomfort, they could actually be part of a constellation of early pancreatic cancer symptoms. The key is recognizing when emotional changes appear alongside physical symptoms, particularly those we've discussed throughout this video. If someone experiences persistent fatigue, unexplained sadness or irritability, and any of the physical changes we've covered, from digestive issues to weight loss, it's crucial to discuss both the emotional and physical symptoms with a healthcare provider. Don't dismiss emotional shifts as just feeling down or having a rough patch, especially when they persist without clear cause or occur alongside physical changes. While not all mood alterations indicate illness, being aware of this connection ensures that potentially serious health issues aren't overlooked. By paying attention to both physical and emotional well-being, you increase your chances of catching potential problems early, when intervention can make the greatest difference. We've explored 8 critical warning signs that could alert you to pancreatic cancer in its earlier, more treatable stages. From subtle digestive changes and unexplained weight loss to distinctive back pain patterns and new-onset diabetes, each of these symptoms provides a vital clue when recognized properly. Add to these the visible signs like jaundice, the overwhelming fatigue that exceeds normal tiredness, specific abdominal discomfort patterns, and even unexpected mood changes, and you have a comprehensive understanding of how this disease might first reveal itself. What makes pancreatic cancer particularly challenging is how these symptoms often blend with common aging issues, making them easy to dismiss or misinterpret. But now that you know what to look for, you've gained a powerful advantage: the ability to recognize when something might be more than just getting older. Remember that critical 3 to 6 month window I mentioned at the beginning? That's your opportunity for early intervention. A chance to potentially improve outcomes dramatically from that sobering 12% 5-year survival rate. Every day of early detection matters in this battle. If you've recognized any of these warning signs in yourself or someone you care about, don't wait to take action. Contact your healthcare provider, describe your symptoms specifically, and ask about appropriate screening. Your awareness and proactive approach could literally save a life. Before you go, please share this video with someone over 60 in your life, a parent, grandparent, friend, or neighbor. The information you've just learned is too important to keep to yourself, and that simple act of sharing could be the most meaningful gift you give someone this year.